Hi, this is Dr. Arun Kannan, Orthopedic Surgeon from Apollo Hospitals, Chennai. I specialize in hip and knee surgery, and in this video I will talk to you about robotic knee replacement. Knee replacement, as most of you might have heard, is a very successful procedure, has been happening around the world for about 4 to 5 decades now, and even in India it has been successfully been there for more than 20 years. We've had a lot of success with the very high number of knee replacements over the last 2 decades in India, and in this we are now trying to go to the next stage or next level with robotic knee replacements. Even with regular knee replacements, we were able to get the alignment very well in 95% of patients. When we do 100 knee replacements, any human, there is a margin for a small error that happens in 5%. That is an error of judgment. We can call it human error. We now have the opportunity to eliminate even that 5% error with robotics. In robotic knee replacement, we get a CT scan of the knee joint beforehand, plan the surgery entirely before the patient comes to the operating theatre. And once he is in the operating theatre, we are able to recalibrate and get the alignment perfectly where we want it. So, the robotic helps with nearly 100% precision while placing the components, meaning we are able to place the components at exactly the angle that we plan. To give you an example, a lot of you would have heard of or seen basketball and would have heard of NBA, which is the highest level of sport in basketball. An NBA player on an average, or the best shooters, they have an accuracy of 75 to 77% when they throw a free throw, meaning when they shoot a free throw, they are able to land it perfectly 3 out of 4 times. This is the best of human accuracy. In that place, there is a robot made by Toyota. It is called a Q robot, and it has been recorded to shoot over 2000 free throws continuously without missing a single shot. And the other thing is that you can create many such robots, even we cannot have that many NBA players. So it is a question of replacing an efficiency or accuracy using a machine, and that is what exactly we are doing now with robotic knee replacement. So we are able to exactly place the components in almost all people wherever robot is used. The other advantage is that we are able to exactly match the shape of the bone with the component. We call this 3-dimensional shape matching. This is using the CT scan data as well as intraoperative robotic imaging in 3 dimensions. Exactly how the bone was, it is the same way after the component is placed. The third main advantage is that the robot has a very specific margin in which it cuts the bone, meaning it does not cut beyond the bone boundary. This ensures that the surrounding soft tissues are not damaged at all. It is very precise. Even the small tissue damage that happens during saw cutting when we do it by a hand is not there with robotic technology. So nearly 100% accuracy, 3D shape matching, and less soft tissue damage. These are the main technical advantages of robotic knee replacement. So you might ask, what advantage does the patient perceive? When this is done, when the soft tissue damage is less, they feel less post-operative pain. This helps them recover faster. And because the 3D shape matching is done, the tissues are very well balanced, and this also reduces the pain and enhances the recovery. And last but not least, because the components are put in exact alignment where it is very well matched, we expect these joints to last longer. So the long-term life of the knee replacement, we expect it to increase over time with the use of robotics. So in summary, knee replacement is a very successful procedure that gave outstanding results in most of the people. Now we have the opportunity to cut out errors totally from a knee replacement surgery, make it nearly 100% accurate, have less post-operative pain, and allow faster recovery. In the long run, we expect these knee replacements to last longer as well. For example, this was a 70-year-old lady who had a robotic knee replacement with us, and you can see that on the second day after surgery, she is able to walk very comfortably with the walker, and on day 2 after surgery, she got discharged from the hospital in a very happy manner. Thank you.